Welcome to the Nestle webinar series for year 2022. So today I'm going to discuss about fussy eaters. So this is just a different topic from the previous topics which we have discussed so far. But though it's not very frequently discussed, I think we all come across this type of children during our day-to-day practice as well as day-to-day life. So let's discuss about fussy or picky eaters today. So actually, what do we mean by fussy eating or picky eating? So this is defined as the consumption of an inadequate variety or quantity of foods through the rejection of a substantial amount of both familiar and unfamiliar foods. So in simple terms, this is characterized by an unwillingness to eat familiar and unfamiliar foods as well as strong food preferences. So anyway, these kids, they just want refuse foods, but sometimes they might have strong food preferences for certain food items as well. So this is very subjective. So one child might prefer or dislike a certain food, but on the other hand, another child might prefer that dislike food. So it's very subjective and differs from child to child. So anyway, most of the parents must have been experienced this problem at one stage of their child's life. So anyway, as parents, sometimes we also might have come across this problem with our kids. So nearly 30% of children, 30 or even more, are truly fussy. But most of the kids, say almost all kids, having this problem up to some extent. So sometimes to a lesser extent or minor degree. So in very simple terms, we can describe this as food refusal above and beyond the expected norm. So refusal of food is normal, but if it is above and beyond the expected range, we could label this as fussy or picky eating. So this commonly occurs at two stages, each with a different cause. So two stages you can categorize into a infant stage. So these infants, they refuse family foods or commercially produced foods such as baby foods. So family food means in our setup, it's always the infant's mashed rice, or what we call is berry butter. So to tell you the truth, this is not so palatable, and most of the children, they just don't. They just actually they don't like the taste or texture of this mashed rice. So the refusal of this family food is more with infants. And when we go to toddler years, they just refuse both new foods as well as foods that they have been previously been eating or consuming. So some kids, even some infants, they grow out of it during the late months of their infancy, or the toddlers even after a couple of years, they might grow out of this disorder. But some kids, they continue to have this behavior from infancy, then to toddler years, and then to the childhood. So they then end up with this eating disorder called avoidant and restrictive food intake disorder. We call it AFID and categorized under DSM-5. So sometimes they might end up with very extremely restricted intake. Sometimes this could be less than 10 food items for their whole meal or their whole life. So let's talk about infant stage in detail. Most of the research reveal that it's genetically determined up to a great extent. So if either mother or father has had fussy eating during their infancy or later stages, their kid also might be end up with the fussy eating. For sometimes they just refuse the same food item. Usually starts around 4 to 6 months once the kid have been introduced for the complementary feeds or once they have started weaning. So these infants, they just have different responses to different taste. Some kids, they might prefer soft or salty taste. Sometimes they just prefer things like cheese or salted butter. Or sometimes they just like the taste of some vegetables like strong, which have strong or bitter taste. And they just prefer certain textures as well. So some infants, they just prefer the rough texture of either meat or fish, and some kids, they love the smooth texture of the vegetables or either fruits. So to overcome this issue, they just need to learn how to process food with their gums and teeth. So once they start processing or chewing these food items, they might feel the taste and the sensation of these foods. So then they might overcome this issue gradually. And sometimes this happens with the kids who have been late to introduce weaning foods or solid foods for some reason. So they have been just relying on milk feeds, either their mother's breast milk or formula feeds. So once they have been introduced these solid foods, they are just reluctant to take solid foods because they prefer that milky taste. And the other problem is most of the parents, they have a limited diet because of their busy work or they are just too busy. They just make their meals with a very limited number of food items, and they just apply same for their kids. So after some time, this small one might get fed up with the limited number of food items he get. On the other way around, some parents, they are just having a lack of knowledge of how to feed their child because they don't know that there are wide varieties of food available for their kids. So they just rely only on few items of food. So kids most of the time they just like to imitate others. So when they are getting along with other kids, either at nursery, playgroup, even at home with other relatives or grandparents, they just start eating. So I think when you manage a fussy eater, better to arrange shared meals with others. So then we'll talk about this toddlerhood, or what we call is this neophobic stage. So neophobic means they have a phobia for the new things. So most of the toddlers go through this stage up to some extent. I think almost all toddlers must have been gone through this stage. So they just try to refuse these foods even when they are less than 2 years of age, just around 20 months. So they start to refuse new foods as well as foods once they have eaten. So the foods once they have eaten must be from a different appearance or the different texture or different taste. So they just try to refuse both of these food items. And sometimes we could consider this as an evolutionary benefit because child only eats very selected number of food items. So as other small kids, they just don't put anything and everything they see into their mouth. So most of the time, they will grow out of this by 6 years of age. And once they grow out of this, they will gradually increase their range of food intake. So they might watch others eating and they might share meals with others and join their plates, especially small kids, they would love to share the meal with their grandparents. So let's talk about the consequences of picky eating. So there are several medical impacts of picky eating. So the first one being actually the most prominent one, nutritional deficiencies. I think as clinicians, we all might have come across kids with this problem in our day-to-day practice. So sometimes picky eaters or fussy eaters, when parents or especially mothers bring their child to the either to the ward, clinic, or to the private sector, they won't straight away say that, oh, my doctor, my child is a picky eater or fussy eater. So they might come across, they might bring a full blood count with a hemoglobin of lower than expected value. So then we might diagnose iron deficiency anemia. So when you take a detailed history, you might come across this problem in these kids. And sometimes some kids, they might end up with deficiency of calcium and other vitamins, trace minerals like zinc, or maybe they are lacking fiber, so might present to you with constipation. And because they are sometimes their diet is lacking in protein and calories, so their energy levels may be low. That would anyway lead to reduced attention span, and so the learning problems may be there with poor school performance, and as well as reduced cognitive effects also. So these two goes together. And because of these nutritional problems, their immune system also is weak. So they are more prone to get infections. So sometimes you might come across a kid who's suffering from recurrent infections, and once you take a detailed history, you might reveal the problem with them with this fussy eating. And they might present to you with increased risk of weight problems, especially underweight, but occasionally we might come across a child with overweight because they are too selective and they consume a lot of junk foods and avoid nutritious food. So these kids, if they prefer sweets or snacks a lot, they might get dental problems. So dental caries, tooth erosions, many dental problems. So there are some social impacts as well. So because of this fussy eating, they have some negative behavior issues. And social wise, parents actually are very stressful. So the meal times are very chaotic, unpleasant, and stressful for the sometimes for the whole family. So there may be conflicts in relationships as well because of this fussy eating. So whenever there's a kid with picky or fussy eating at home, both parents are very stressed. And these conflicts of there may be conflicts in relationships because most of the time one parent, most of the time its mother, tries to feed the child, uh, sometimes very forcefully and sometimes might scold the child even. So this might break the bond between the mother and the child, and among parents as well, because one parent, most of the time its mother, tries to feed the child, while father sometimes might say we'll just wait and see. So there may be conflicts between two parents as well. So this negative behavior put an impact on the child's behavior as well, social relationships. So when they get along with other peers because of this feeding problem, they are just withdrawn, sometimes even at the classroom or else in the playgroup or at the nursery. So less likely to have good social relationships. So how to handle toddlers with this problem? So I will just discuss what are the things you shouldn't do. So better not to introduce new or dislike food with like food. So when you are introducing a new food or dislike food, you can't mix it or serve it along with the foods which child prefers. So then he will start to throw away everything. So better to introduce this away from a meal, say before a meal, say you can keep 1 to 2 hours gap between a meal and then introduce the new food. And later on, you can have the usual meal, and then sometimes you might later introduce the new food or disliked food. So never ever force your kid to eat. You have to do it very patiently, slowly, and you have to talk to them nicely and do this. So once you withhold the unhealthy foods, say for example, if a particular child is relying mainly on junk food, say for example pizzas, uh, potato chips or whatever the junk food he is eating, you can't withdraw or withhold them entirely at once. So you have to do it very slowly, because if you withdraw this thing, he or she will get more desire for this food. On the other hand, you might withdraw in the sole source of energy from this child's diet. So that would be the end of the story. So you have to do this very slowly, gradually, and patiently. So you have to reward your kids as well. So once they have actually tasted the new food, or at least a small portion of new food, you have to reward her. But never use foods as rewards. Say, for example, you might give a chocolate to a baby who has taken one of the disliked food items. But no, you have to reward with something else, say some sticker, toy, or a storybook. So let's talk about the other spectrum of this illness, the end of the spectrum. So we call it, as I have mentioned earlier, avoidant and restrictive food intake disorder. So this is defined as an eating or feeding disturbance as manifested by persistent failure to meet appropriate nutritional and or energy needs associated with one or more of the following. So there are four diagnostic criteria. First one is significant weight loss. So because of this eating disorder, they lose a lot of weight, and there may be significant nutritional deficiency. So sometimes they might end up with, depending on enteral feeding or oral nutritional supplements. And because of this issue, there may be marked interference with psychological functioning as well. So these kids, of course, sometimes adults and even adults, they are very resistant to change. It's very hard to introduce new things and change in their eating behavior. So this is almost similar to anorexia nervosa, and they share most of the signs and symptoms of anorexia nervosa. But the thing is, they don't care or concern about the body shape, size, or fatness. Only thing is they avoid a lot of food items, and they are fear of trying new foods, because so they are they just have this fear of trying new foods. They just rely on only limited number of certain food items. So, as I have mentioned earlier, we have to manage these patients very slowly and gradually. So, you have to do it very slowly. So, if they are, say, relying on non-nutritious food, you have to withdraw them slowly from their diet. You can't do it within 1 or 2 days, and this takes some time. So there are risk groups who might have more risk of developing this disorder. So they are children and adolescents with autistic spectrum disorder, children with attention deficit hyperactive disorder, and children with intellectual disabilities, and children who have been who had severe picky eating, who didn't outgrow this problem once they grow old. So these categories have more risk of developing this eating disorder. So there are some warning signs and symptoms of ARFID. So first we'll talk about the behavioral and psychological problem. So these patients anyway have very dramatic weight loss. So within say few weeks, couple of months, they just lose a significant weight from their original weight. So they are just so thin and they just want to hide their thinness or weight loss. So sometimes they use thick clothes or wear several layers or several number of clothes to hide their weight loss or thinness. Sometimes this is because they have cold intolerance and they want to stay warm even. And they might complain of some problems like constipation, abdominal pain, GI issues like vomiting, reflux, and as I have mentioned earlier, cold intolerance, lethargy, sometimes excess energy because they are being fat. And over the time, there's a dramatic restriction in types or amount of food eaten. So sometimes gradually the number of food items they have been consuming become less and the amount as well, right? So earlier if they have been say eating 2 cups of rice, so might end up with eating 1 or 1.5 cups of rice, and they just prefer food with certain textures, and they just have a fear whether they will choke or vomit, and their appetite is very less, and the interest of food also is limited. And as I have mentioned earlier, this the range of preferred food also becomes narrow. And physically, they complain of some GI gastrointestinal symptoms like cramps, because sometimes there may be derangements in electrolytes or electrolyte imbalances. So they could have reflux, constipation, and females with menstrual irregularities. So attention span is less, and they have difficulties in concentrating. And likewise in anorexia nervosa, you might see abnormal laboratory findings like anemia, hypokalemia, hypothyroidism, bradycardia, and they could have syncope, sleep problems. Because of the nutritional problems, they will get dry skin, brittle nails, thin hair, and cold mottled hands and feet. Swelling of feet may be due to lack of protein, and hair likewise you see in anorexia nervosa. So share most of the features of anorexia nervosa. So the exception is they are not concerned about the body image or being fat, and they are very selective of food items. So how to manage fussy eaters? For tips for the family. So this is for the most of the time for the parents. So you have to create a mealtime routine. So I think preferred meal time would be dinner, because most of the family members away from home for the breakfast and lunch. So most of the time all the family members get together for the dinner. So you have to have a nice mealtime routine. So before your meal, once you prepare your food, you can get help of their kids, especially who are fussy on certain food. Say for example, if your child is has a limited preference or refuses vegetables, you can ask their help to prepare a vegetable salad. So once they touch and feel the sensation of these vegetables, once they get the smell, once they say whenever they are preparing, sometimes they might taste it with bits and pieces of this vegetable. So they might get a craving or desire for this particular type of vegetable. So you can just get their help for preparation of food. You can, as parents, they can give them choices. So not many, either 2 or 3 choices. So you can eat this, or if you can't, you can eat this, right? And so once you are introducing new foods, sometimes you have to be a little bit tricky. So you have to do this with the same flavor or sensory properties of the preferred food. For example, if a particular child prefers yogurt, you might introduce a dessert which has similar flavor or taste as a yogurt, or you can just add some yogurt to that dessert. So for the small infants, you have to start solid foods at least by 6 months. So you can actually add lumpy foods by 7 months. So you have to limit time for the feeding, limit grazing. You can't actually spend hours and hours for feeding your kid. So you have to limit the time. And once you offer new foods, you have to think that your child might like this and will eat. Right? You know, as parents, they know their choices. So you have to think of their choices and start introducing. So once you introduce, you have to give them in small quantities, not a huge amount at once. So say for example, if you are introducing an omelette, uh, as so preparation of egg. So first, so child might actually refuse eggs in the first instance. So you can just prepare an omelette and start with a small quantity. Say, for example, you might give either quarter or 1/8 of a portion of an omelette on the first day. So later on, you can just gradually increase the quantity. So once they have taken the feed, enjoyed their feed, you have to reward and give lots of feedback, praise them. And until you overcome this problem, you have to supplement them with vitamins and other minerals. So, advice for our parents, Sri Lankan setup. So, in Sri Lanka, so we have lots of meats and food fads, especially among our grandparents, especially grandmothers. So they say there are a lot of chili foods. Chili food, they actually label these as chili foods, yogurt, eggs, say curd. Sometimes they won't allow mothers to give these foods whenever their child is having a respiratory infection or during cold days. And hot foods, say tuna fish, salmon, breadfruit, and actually these foods I think more palatable than usual food. So you have to discard all these mixed and food fat and try to feed our children. And then we have to try alternatives for main meals. Sri Lanka, we live in a country where we have lot of many varieties of foods available, and our parents, mothers, they are good cooks. So why don't we eat rice and curries for all 3 meals? So we can just change our breakfast routine. We can introduce milk rice, boiled grains, or things like string hoppers. There are a lot of choices available, right? Child might prefer these things. So day by day you can change your menu. And for the lunch, it's of course rice and curries in our setup. So you can just change the variety of curries or these dishes of meat or fish or other delicacies available. And for the dinner, again, you can change your routine. So you can prepare things like noodles or pasta. I think most of the kids would love these dishes. And homemade fried rice. There are several options available. So our mothers have to be a little bit tricky, uh, have to have some culinary skills, and actually creative as well. So you can just mothers try can different preparation from the same food. Say sometimes whenever even we I come across sometimes one mother might come and say that this especially underweight children. Whenever I ask, are you giving eggs to this child? Yes, but she baby refuses. So I usually ask, how do you give? Then they most of the time they say I give a boiled egg. But why don't you? Why can't you give an bullseye or omelette, which is more nutritious and more palatable for the kids? So child might prefer either way. So you can just try food with different textures and appearances. So this is an example. So mothers, as I have mentioned earlier, have to be a little bit tricky, creative, and have to have some culinary skills as well. So child who refuses to eat fruits and veggies, you can just arrange in a nice way and offer to the child. And if they refuse to eat individual foods, you can just fruits you can just try a fruit salad, add some yogurt, add some ice cream. So offer in a more palatable way. Same with fish and meat. So last but not least, our role, pediatrician's role. So how do you manage or handle these kids and their mothers? So first of all, once you meet this mother or baby's mother, right? You have to advise them to give preferred foods to maintain growth. So until you can't actually treat or manage this child within couple of days. So this takes some time. So until you overcome this problem or issue, you have to advise them to give preferred foods until you gradually manage this kid. So don't try to withhold the preferred food entirely from their diet. So reassure when appropriate about poor dietary balance. So mothers, they are just worried. So whether my child is getting enough vitamins, iron, calories. So those are their concerns. So you have to reassure them because as long as child remains asymptomatic without having any nutritional deficiencies, you can ensure that they are getting however balanced diet. So sometimes say our mothers they just think that stable diet has to be rice, but if child is getting something like say noodles or some kind of a yam or just things like milk rice, so they are getting the carbohydrate from that staple food, and they are getting other minor nutrients from whatever they eat. So you have to reassure parents. And meanwhile, you have to screen these children for their dietary deficiencies, mainly iron, calcium, and carefully examine and see whether they are having any nutritional deficiencies. And at last, you have to counsel these parents. You have to sit with them, take time, and advise them regarding more options in the diet, as we have been discussing so far. Because sometimes mothers might think that we are left with only few options in the diet, and they just try to feed their child with only limited variety of food. So take time, counsel the parents, and give them more options. So I have taken some references from this Journal of Pediatrics and Child Health. The symposium was Nutrition, August 2017.